Good morning, Mrs. M. I'm Emily. I'll be your nurse for today. Today, I'll be taking your vital signs. How are you today?
I'm not feeling well. You know, last night I didn't sleep well because I had a pain in my lower back and also in my right shoulder. It's really painful.
That must be terrible. The rate of 0 to 10, can you tell me where is 0 is no pain at all and 10 is the worst pain imaginable? How can you rate your pain today?
I can say that it is 9, and you know, pain is the worst terrible that you can have.
Can you describe to me the pain? Is it throbbing, sharp, intensify?
It is sharp and aching, especially when I move. It's really painful.
Oh, your vitals are okay, Mrs. M. I'll leave a note for the physician to review it for your pain, and I'll be back for your pain medication, okay?
Okay, thank you.
You're welcome.
Nurse, I want to go in the washroom.
Okay, I'll assist you. Let's lower your bed first. Okay, you're good. Careful. Take it slow. Are you okay? Take your time, Mrs. M. Don't need to be hurried.
It's really painful.
So, yung pasyente natin, anong nangyari? Nagko-complain siya ng pain sa likod. And then, what happened?
Yung medication niya, nag-add tayo ng
I see. Yung medication
PRN
niya, yeah.
for hydromorphone.
Ano yun? Anong hydromorphone?
Para sa pain. Di ba meron siyang 4 hours o 4 times a day na
I see.
hydromorphone.
Oh, yeah.
Tapos nag-add si doctor ng
Excuse
PRN.
me, can we speak some current English, like all the time, so I can understand?
I'm so sorry.
Oh,
Sorry.
sorry. Thank you.
Ladies, you have to speak English. Monica is
Yes,
here.
Okay.
Okay.
Thanks.
Hi, good afternoon. I'm Hyastella. The physiotherapist of the team. So, as a physiotherapist, I'll help patients with physical difficulties like resulting from illness, injuries, or accidents, or falls, or any patients who are aging to improve their movement. So, I will use the device and review treatment programs using manual therapy such as massage, therapeutic exercise, and electrotherapy. So, I will use device like the walker, the cane, or the wheelchair for patients to have to gain or to have devices to activity of daily living.
Nice to
Thank
meet
you.
you, Hyastella. Thank you.
Thank you.
And hello, everybody. My name is Monica.
Hey, Monica.
I am the occupational therapist, so I'll be working hand to hand with you and with everybody, obviously. So our role as the occupational therapists are to use systematic approach to enable Mrs. M in this case to go back and develop what it means for her opportunities, to help her identify herself and go back to the society. So let's say if in the past she used to do volunteering or go to the shop by herself to do her groceries, we want her to be able to go back to the same or as close as we can to that extent. That's our goal.
Hi everyone, I'm Emily. I'm the nurse in charge with Mrs. M.
Okay.
So I provide the hands-on care with Mrs. M, administer medication, and observe and monitor if there's any changes in her condition, and relay any important information regarding any sudden changes in her condition, especially with a physician, the other members of the interprofessional team like you. So that's why we're here together today. And beyond that, the physical support, we also give emotional support for the patient, their family members, and we also give patient education not only for the patient but also to the general public.
Okay.
Okay, so hi everyone. I'm Venus. So I'm the pharmacist in charge for Mrs. M. So I'm usually in charge of dispensing medications, to monitoring the patient health and progress to maximize the client's response to the meds. So I spoke with the patient about the complete list of her medications and provided patient direct education to get the most out of her drug therapy. So what I can do for the team is I can clarify all vague medication orders to eliminate any confusion regarding the use of the medications. So if any time that you need some clarifications regarding Mrs. M's medications or the doctor's orders, you can just ask me anytime. You can contact me, you know my number. So,
Okay, thank you, Vanessa.
Oh, hi. Thank you, ladies. You did your job for the discussing your role for our patient. Well, I am Dr. Reina. What my plan for now is that we have to see first and assess the client what if she has intended for a surgical management for this one. So to help decide if there is a fracture that can be managed non-operatively. But our client is already 85 years old, so we have to consider her age also.
So I'm going to discuss about our client, Mrs. M. So she's female, 85 years old, admitted last January 31, and she was in full code status. And her presenting signs and symptoms was his lower back pain, body weakness, limited mobility, poor balance when standing, and less appetite. For her primary diagnosis, it was lumbar compression fracture. And secondary diagnosis that impacts her admission presently was the multiple falls, secondary to poor balance. And for her health history, previous past history includes multiple falls in the past, and the latest was 3 weeks ago at home where she's unable to get up and complain of pain in the lower back radiating to the pelvis.
She has a lot of falls.
Yeah, I know. And then she has also have hypertension before, rheumatic fever, and she has also broken elbow 15 years ago.
Oh no.
And had a right total elbow arthroplasty. And she has a shingles left her with nerve damage and neuropathic pain, secondary to spinal cord injury again. So she has allergies for codeine, sulfonamides, clarithromycin, and carbamazepine. So for now, she's current medication. She's on acetaminophen, acetylsalicylic acid, cyanobalamin, duloxetine, folic acid, gabapentin, and hydromorphone for her pain, and levothyroxine, ramipril, polyethylene glycol, glycosides. And currently, her latest vital signs is normal. all normal except for the pain. She complained a lot of pain, and she said she
you
has
have to manage that pain.
and she has 9 out of 10 for the numeric scale for pain. And she verbalized about that it's sharp and aching and intensifies when she's moving out from bed. She's telling that she verbalized that it is the pain. The pain is the worst thing you could have. And last night he has a terrible and didn't get enough sleep. So
So as I said before, surgical option is not possible right now. So we are talking about conservative treatment for the, as a choice. So we have to focus on the pain relief and bracing, like putting a TLSO to support her back, and also rehabilitation. So that's it. So the focus here is that early mobilization of the client is important to decrease the frequency and secondary medical complications for her.
Okay. More on alternative measures right now for us.
Okay, so we will make sure we get the patient right after medication has been given, so that we don't have her, like maybe 20 minutes after the medication, so that she's not in pain when we get her up.
Of course.
And then I guess it will be very important to maintain activity so that she doesn't get constipated, right? Because if you're increasing the hydromorphone, then that's just gonna make her more constipated.
Yeah, you have to take a note of that, I guess, for giving her laxatives or whatever.
So nurses, you will give the report to me, and then I rely on you guys. This therapist, you can help her out, so she can move on every day.
Yeah, so for my recommendation about my patients, that I can assist her like every day after the breakfast, maybe 30 minutes if she can, and then walk with a walker. And then if ever she can't do it, then maybe let's do like ROM or range of motion exercises, so that her muscles and her knees are not that atrophy for the meantime.
All right. Sure.
Excuse me, a bit call. My patient call. Okay.
I guess we're gonna stop for now so she doesn't miss anything.
Okay. Sorry, ladies. I just got an important call. Did I miss something?
No, we actually stopped to wait for you.
Okay.
So as a last thing, what I wanted to add was we will make sure when she goes back home, everything at home is set up. So whatever she can do here, she's gonna be able to do it there. So we'll have to talk to her family to make sure they find a toilet seat so that she continues to progress better. She won't increase on the fracture, make it worse. And everything at home, we have to make sure there are no things around her so she can trip or anything to reduce the risk.
Yeah, it's a very good idea, don't you think?
Yes. Okay. That will be the plan for now. And then we will come back and see. We want to show you some ideas of how to help her move around.
That's good.
So that you know how to handle her and that she loses fear, because now that she had a fracture, she may be
lots of falls.
Exactly, and she may be very fearful of moving because she just had her fracture. But we want her to get the confidence again, so that she's up on her feet, moving around, and then reducing the risk. We just have to show her and teach her how to do it. Okay.
I'll just update you as well with if there's any sudden changes in the client's condition.
Thank you.
Yes,
That
thank
would be
Okay,
great.
thank
Yeah.
you. I guess that's it for our meeting right now.
Hi, Mrs. M. How are you? I'm with Dr. Reina and Venus, the pharmacist, and they're going to discuss some of the issues you have. Okay?
Good morning, Mrs. M. How are you doing today?
I'm good.
Oh, you have any pain?
Yeah, I have pain in my lower back here.
Okay.
It's really painful, especially when I move. And
So,
also, on
can
my
I
shoulder.
check first your breathing? Can I check it? Can you stand up, okay? Or can you sit back for me? Okay. Is that okay? Oh, okay. Can you take a deep breath for me? Okay. Wait. All right.
Okay, Nurse Emily, continue to monitor her pain, and you tell me you take note for this, and you just inform me, okay?
Okay, doctor.
So take care and see you tomorrow.
Thank you, doc.
Yes.